If you're not happy with your hearing care professional, apparently you're not alone. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm exploring the reasons why provider satisfaction rates have been continuing to decline over the past 10 years. Do you like your hearing care professional? Hopefully the answer to that is a resounding yes. But since 2015, less people have been answering yes to that question. According to recent market track data, satisfaction with hearing care professionals has steadily declined over the past 10 years, even while hearing aid adoption and hearing aid satisfaction have remained relatively stable. So what the heck is going on? Well, in this video, I'm going to explore 6 different things that I believe are leading to a reduction in provider satisfaction among individuals with hearing loss, and what you can do about it to make sure that you continue to love your hearing care professional over the course of the next 10 years. And I will say that number 6 on this list is not going to make me any new friends. But before I share what all of these different things are, do me a huge favor and click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. The first reason why I believe that provider satisfaction rates are continuing to decline over the past decade is the increased focus on hearing aid sales. At some point, the mentality inside of the hearing aid industry went from, what do I need to do to treat your hearing loss, to, what do I need to do to sell you another pair of hearing aids? The focus completely changed from maximizing your treatment outcomes to trying to figure out how to sell you another pair of devices sooner. Nowadays, you see full-page newspaper ads trying to find 20 people who are willing to test out a new hearing aid technology, to endless postcards that you receive in the mail promoting their $299 hearing aids. And all of this is followed by high-pressured sales tactics in order to bait and switch you into different hearing aids that cost you a lot of money, even if you have to finance those hearing aids at 20% interest over the course of 5 years. Nowadays, when you ask a typical hearing aid clinic how they track their success inside of the clinic, they're typically going to tell you one number, which is the amount of hearing aids that they sold that month. Very few clinics will actually look at treatment metrics to determine if their clinic is being successful at treating hearing loss. It's no wonder why so many people nowadays compare their hearing care professional to used car salesmen. Clearly, I'm not talking about all hearing care professionals here, but inside of an industry that definitely incentivizes hearing aid sales more than anything else, it is likely going to lead to a reduction in provider satisfaction rates among individuals with hearing loss. The second reason why I believe there's a reduction in provider satisfaction rates is the significant increase in big box retail. Big box retailers continue to be a very popular option among first-time hearing aid users, and they have an almost cult-like following on social media. And rightfully so. They sell good quality hearing aids by hearing care professionals who are often mandated to perform real ear measurement when programming those devices. But the goal of big box retailers is very simple. Sell as many hearing aids as they possibly can at low margin in order to ensure profitability. And this volume-based care can limit the time and attention that you receive from your hearing care professional because they have so many people to serve. Now, is it possible that the rise in popularity of big box retail hearing aid clinics and the decrease in provider satisfaction is completely coincidental? The answer, of course, to that is yes. But it is also entirely possible that this particular business model is having a negative impact on these provider satisfaction rates. Now, don't jump on me in the comment section too quickly here, because independent hearing aid clinics are not off the hook either. The third reason why I believe provider satisfaction rates continue to decline is the rise of corporate-owned hearing aid clinics. When you think about it, the hearing aid manufacturers are not the only ones consolidating. We've also seen a rise in consolidation of hearing aid clinics. Over the past 10 years, we've seen a rise in private equity and manufacturer funding that has fueled the consolidation of independent hearing aid clinics under new management. And when these clinics transition from independent ownership to corporate ownership, providers often have less autonomy on how care is delivered. All of a sudden, a clinic that was owned and operated by a hearing care professional over the past 20 to 30 years along with their team has new ownership, and they have entirely new goals for their clinic. And these goals are often centered around growth and profitability rather than individualized patient care, which means that even if your hearing care professional wants to provide you with better service and higher quality of care, which would likely lead to higher provider satisfaction rates, this likely would not align with the goals of the new corporate owners. But this is where it gets even more interesting. The fourth reason why I believe that provider satisfaction rates continue to decline is the lack of provider training on person-centered care. Now, don't get me wrong, there is plenty of training that occurs inside of the hearing aid industry. However, the majority of this training is on technology, not on patient interaction. This is probably why certain states limit the amount of training that you can receive directly from a hearing aid manufacturer when it comes to renewing your license. But even if a hearing care professional is technically proficient with hearing aid technology, which I do believe they should be, they also need to be very proficient with how to interact with their patients in order to maximize treatment outcomes. If provider satisfaction rates have any chance of recovering over the course of the next 10 years, I can promise you that it will not be due to a provider having a better understanding of the technology that they're fitting you with. It will be due to that provider's ability to communicate effectively with you and identify your wants, needs, and values when they're administering your treatment. If we can somehow pull that off, I think there's hope for you in the future. As long as the fifth reason doesn't get in the way, which is the amount of influence that your insurance and their third-party administrators have on your overall hearing care. Just like the medical world, insurance companies have significantly increased their influence inside of the hearing aid space over the past decade. As insurance companies and their third-party administrators like True Hearing, Amplifone, Hearing Care Solutions, and Epic have increased in popularity, hearing care professionals have become less popular. Not only do these insurance companies dictate the hearing aids that you can get, but they also dictate who you can see, how much time your provider can spend with you, and what services your provider can provide you with. In order for insurance-based care to work, a hearing care professional has to see more patients in less amount of time and provide the level of care that the insurance dictates. So if your provider lets the insurance company dictate the quality of care that they can provide you and how much time they can spend with you, that is a recipe for you hating your hearing care professional. Unfortunately, with the way that things are going, you have two options here. You can either continue to let insurance influence the care that you receive and how much satisfaction you have with your hearing care professional, or you can go to a hearing care professional who is not influenced by insurance, which often means that you're foregoing whatever your insurance discount is. And only you can decide which route you truly want to go. But this leads me to the sixth reason why I believe provider satisfaction rates continue to decline, which is higher patient expectations. Now, it's probably a coincidence here, but in 2017, I started this YouTube channel primarily to educate you on what you should expect from your hearing care professional in order to achieve a high-level treatment outcome. Over the past 9 years, I have educated millions of individuals worldwide. The problem is, when an individual with hearing loss becomes educated and the hearing care professional that they're entrusting with treating their hearing loss is not meeting their expectation, their satisfaction in their provider is going to be lower. The crazy thing is, I still think that patient expectations are way too low. When you consider that very few hearing care professionals are following comprehensive audiologic best practices, a lot of individuals who are having their hearing loss treated are leaving a significant amount of hearing benefit on the table. And unless they educate themselves, they have no idea that this is happening. Personally, I would not be satisfied with any medical professional who is not following whatever the best practices are inside of their industry. But for some reason, that same mentality has not carried its way into the hearing care industry, and it should. But you know what? At the risk of driving down provider satisfaction rates even further, best practices are a series of considerations and procedures that have been proven by research and must be followed by your hearing care professional in order to maximize your performance with your hearing aids. They include speech and noise testing to identify how much separation you need of speech over background noise to be able to hear, diagnostic test box measures to ensure that your hearing aids are meeting manufacturer specifications for performance, real ear measurement to ensure that your hearing aids are programmed properly to your hearing loss prescription, and validation outcome measures to ensure that your hearing aids have been optimized to improve subjective hearing performance in a variety of situations that are important to you. And these are only 4 of many best practices that must be completed by your hearing care professional to ensure that you're able to hear your absolute best. If you want to know what the rest of them are, I will go ahead and put a link in the description of this video where you can download my best practice checklists. And if you want an easy way to find one of these rare hearing care professionals who follows best practices to make sure that you love your hearing care professional, make sure that you check out my website hearingup.com and find a Hearing Up Network member in your area. Hearing Up members are not only committed to providing comprehensive audiologic best practices, but they also spend significantly more time with you than an average provider and work with multiple hearing aid brands to ensure that you're able to hear your absolute best. Unfortunately, and I hate to have to say this, but the way that things are trending inside of the hearing aid industry, things are likely going to get worse when it comes to provider satisfaction rates rather than getting better. If you're lucky, your hearing care professional is not going to allow any outside forces to dictate the quality of care that they provide you with. But if you do identify that your hearing care professional is not able to provide you with the high level of care that makes you satisfied, chances are you're going to have to find a different professional. Even if that means you have to forego your insurance hearing aid discount or you have to travel further to get to a provider who's better. The thing that I want more, even more than better hearing aid technology over the course of the next 10 years, is individuals loving their hearing care professionals more more over that same time period. But I want to hear from you. Do you think that there's anything that I missed that's potentially leading to a reduction in provider satisfaction rates? Let me know down in the comment section, and I'll see you in the next video.